My process is to reject the current model of healthcare. And the reason why I reject the current model of healthcare is because there's no attempt to find out why a person has what they have. It's all about your symptoms and how to alleviate them without trying to find out why. And usually there's a pharmaceutical agent, a drug, that kind of band-aids your symptoms and can potentially make you feel better, but doesn't really get after why you have what you have. And I think that's really important if you're going to do long-term health view, that you have to find out why you have what you have, not what you have. You deserve to have a personalized approach. And the way to have a personalized approach is to do lab tests, a thorough history, and get into the mechanisms of why you have what you have, rather than to identify what you have. I've studied with the top clinicians in the country for the last 20 years, and I did that because I got a degree as a nutritionist. And also, I'm very involved in neurooptometry and figuring out the pathways from the eye to the brain. I have a program that involves addressing 7 steps to health that I find are critical. Of course, there's more than 7 steps to health. For instance, good sleep is critical to health, and that's not in this, and that's sort of a given. Exercise is, your body was designed to move, so that's not in there, but that's kind of a given. We all know this. The 7 steps that I have here are designed to get to the bottom of why you have the symptoms that you have. And they are, you have to get rid of toxins. And there's routes and pathways that need to be open so that you can get rid of the toxins in your body. Number 2, you have to be able to assess whether or not you have anemia and what to do about it. Number 3, there's a hormone system that you have that needs to be assessed. There are huge amount of symptoms that result from imbalanced hormones. Your gut needs to be addressed as well. Your gut is critical to your health, and it's a huge part of American healthcare that I believe is mismanaged. Your blood sugar has to be stable. Most chronic diseases have underpinnings of blood sugar imbalances, so that's another critical factor. Number 6, to make sure that their inflammatory systems are slowed down. And number 7, to find out what irritates the person's immune system so that we can identify those and eliminate them one by one.